I went to several dentists and there was not much anybody wanted to do anything because they said my jawline was crap and there's not much you can do, except for one guy.
Kris, like the referring dentist, he had said my case was quite too far gone. It was quite bad already. So that's why I got referred straight to Janice. So
I like to leave my dentistry at the door, so I know that Janice is there for me when there's cases that it is certainly out of my scope or they need that extra level of management.
Patients who come to my practice have already done the rounds. Once they get to this point, they realise they're at the end of the road. They just want to find a solution.
I don't know what I need. You have to rely on the best advice.
As the general dentist in this situation, who you refer to is of the utmost importance, that you need to know that that patient is going to be treated, with the same care and love that you would have treated them. And I think with Janice, that definitely happens.
I'm confident in my work and I think there is a trust and I do look after them.
I know that she will look after my patient. She knows there's a person at the end of those teeth as well, and she'll formulate her treatment plan accordingly. And as well as providing excellent service and treatment, I know she'll have that holistic approach to looking after my patients.
We are on the journey together. And so with the work that's been done, it's that complex. There's so much planning and technique behind it. We need to come up with a plan that encompasses all of that so that it will work.
It's all the other bits and pieces. It's the correspondence, it's the letters back, I know Janice or the team are at the end of a phone call if I need them. It's the facilities, it's the feedback I get from my patients, that it does reflect on me as the general dentist in this situation. So I know that the whole package is there when I send patients.
The most important is maintenance. It's how to look after it. They will go back to general dentist at 6-month mark for a checkup and clean.
They still come to my practice for their 6-monthly maintenance.
That is what makes a huge difference about whether the result will last.
And I get to have a look at the work and it's holding up beautifully at that 10+ year mark, and still those patients have a very fond memory of their time. They do respect and appreciate that the general dentist in that situation has managed to diagnose appropriately and then refer them on to the correct person. And I think finally to have found their forever clinician in their dental journey is what they really do appreciate the most.